So welcome everyone to today's webinar on disclosing and reporting of abuse against older adults. Today's webinar is being co-hosted with the Canadian Network for the Prevention of Elder Abuse, and my colleague Benedict Chaplin is joining us today, as I mentioned, and will be helping during the session, monitoring Q&A as well as the chat box. So we're so pleased to be able to collaborate and host this session together. As well, we're also pleased to have our speakers, Christine Walsh and Kirsten Rogers, joining us to provide this session today. I do want to provide our land acknowledgement before we get started with the presentation today. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. Thank you. Just basic logistics for the webinars. Similar to our past, everyone's microphones and video has been turned off. I mentioned you can post comments during the session in the chat box. This is a reminder, we do have a lot of people on our presentation session today. So if you have a specific question that you want to ask the speakers, please put it in the Q&A box, because if everyone gets busy in the chat box, we may miss your question and we don't want to do that. So just on the note you'll see at the bottom of the Q&A, just post the question there. As I mentioned, we're fortunate to have our ASL interpreters with us today. They will change screens between their interpreters. You can change your view of, if you want to see speaker view or gallery view, that is your individual choice, how you prefer to see. And you can also engage the closed captioning option on your screen as well. We do appreciate feedback on our sessions. So at the end, I'm actually going to do a few polling questions at the end, but we'll also receive a follow-up email survey link if you don't have a chance to stay to the end to provide your feedback on sessions content today. And we are recording the webinar, and it will be available on both EAPO and the CNPA websites in the next coming days. That will also include any links that Benedict shares during the presentation today or our speakers. They will be posted on the website along with the recording and the PowerPoint presentation. So we know that when we speak around issues pertaining to elder abuse, there's a lot of people that may be experiencing some personal circumstances. But we would like to respect everyone's privacy and confidentiality. If you have a personal issue you would like us to further assist you with, we just would encourage you to call us directly or email us to provide that one-to-one support. This is a public forum, so any information that's posted will be publicly seen by other participants. I know you can't post questions anonymously if you choose to. But if you have a personal circumstance, we would be more than happy to support you offline for that confidential conversation. And for those who are joining us for the first time, I know we have some new people joining us today. So if you're not familiar with our organization, I'm with Elder Abuse Prevention Ontario, and our vision is really to make sure that all seniors are free from ageism and abuse, where human rights are advanced, protected, and respected. And we actually modified or updated our vision and our mission because we feel it's so important to address the rights and ageism in the work that we do. We support the implementation of the Ontario Strategy to Combat Elder Abuse, which is funded through the Ministry for Seniors and Accessibility. I'd like to ask Benedict to talk about a little bit about her organization and the work that they're doing at the Canadian Network.
Hello, everyone. Thank you so much for being here today. I see about almost 500 of you present. That's really impressive. I've been busy answering the chat box. So, if I don't respond right away, just give me a couple of seconds. There are many of you. But to introduce the NPA that you probably know if you've attended other webinars with us, we are a pan-Canadian organization, and we work to build awareness, support, and capacity to build a coordinated pan-Canadian approach to the prevention of elder abuse and neglect. So through our work, we aim to promote the rights of older adults, and we do that through knowledge mobilization, public education, collaboration, policy reform. And really, our vision is shared with, I think, the speakers today, as well as Rayanne, which is that all people who are aging in Canada can have access to the services and the supports that are necessary so that they can have a good quality of life and live safely in their community without fear of violence and neglect. If you want to know more about CNPA, or if you're looking for resources about elder abuse, whether that is the kind of help and support you can get organized by province and territory, or more specific information, reports, fact sheets, stats, what to do in cases of elder abuse, how to recognize the types of elder abuse, et cetera, you can find it on our website, cnpea.ca. And if you are a user of social media, you can stay in touch with us through X, Facebook, and LinkedIn at CNPEA.
Great. Thank you so
And
much.
Rayanne, before we launch any further, someone is asking, they seem to have only an option to communicate with the hosts and panelists and not the whole of the group. So I'm not sure if that is just an individual issue or a system issue, but just flagging that for you.
Okay, I will look at that after we start the presentation from our speakers. Thank you. So yes, it gives me great pleasure to introduce our speakers and just a little bit of background and why we're doing our presentation today before I introduce Christine. We know that reporting and disclosure is a very difficult for older adults when they're experiencing abuse. And we know often people underreport or don't report at all. So the research they're doing is kind of going to shed light on a little bit around understanding the barriers and facilitators of disclosure for older adults living in the community. And they've done a lot of research in this area, not only within this study, but many other areas of work. So we're so pleased to have both of them with us today. So I'd like to introduce our first speaker, which is Christine Walsh. She is a professor at the Faculty of Social Work at the University of Calgary. In her community-based action-oriented and arts-informed research, she partners with community-based agencies, understands the lives of individuals who are impacted by interpersonal violence, poverty, housing insecurity, and homelessness, and social isolation and exclusion. She's also worked with marginalized populations, including older adults experiencing abuse. So we're so pleased to have you with us, Christine. And along with her is her colleague, Kirsten Roger, who's also a professor in community health sciences at a University of Manitoba. And a lot of her research has focused on chronic illness, aging, caregiving, and end-of-life studies. Dr. Rogers has various national funded research projects and collaborated with both national and international research initiatives, and is also engaged with many nonprofit organizations and graduate students in her research work. I know they have a wealth of information to share with us today. So I'm going to stop my screen and allow Christine to start her presentation. Thank you.
Oh,
You just have to advance to your slides.
sorry, I'm sharing the wrong presentation.
That's okay.
Let's do this.
Go.
I'm not sure which one I'm sharing now. Sorry.
You just scroll up to the top of your first slide.
Okay, sorry about that. As noted, we're going to talk about the disclosure and reporting against older adults. I'm also going to start with the land acknowledgement, although I work at the University of Calgary. Currently, I'm in Hamilton, which is the territory protected by the Treaty of the Dish with One Spoon Wampum Treaty. And I just like to ask each of us to reflect on the land that we're living on as uninvited settlers and acknowledge that we are responsible. We have a role in the reconciliation of with Indigenous people, and we're all treaty people. So much of what I'll start with are things we already know, just a little bit of background. As we know, Canada's
Sorry, Christine, can you just go to the very first slide of your presentation?
And make it full screen as well so we can all
Yes.
see what you are doing. Thank you.
Oh, to me, it looks full screen.
You might be sharing the wrong, do you have two screens? I can share my screen if you want.
Okay, can you do that? Because there's so many
Yep.
screens here now.
No problem. There we go. Is that better?
Okay, so can we move on to about 3 slides? Just a bit of background to the next slide, please. So as we know, the Canadian population is aging, as with most other countries globally. And this is really unprecedented, and it's expected currently older adults are comprise about 7.5 million Canadians. And of course, we know this is going to increase. And unfortunately, with aging comes increasing rates of older abuse, and it's been recognized as a public health issue globally. We also know with the recent COVID-19 pandemic that older adults have experienced additional hardships, including escalating rates of interpersonal violence and elder abuse. Next, please. I think everyone in the room probably understands the definition of elder abuse, but the World Health Organization defines it as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. And there's many types of violence, and as we're understanding these issues more, we're becoming more sophisticated to more contextualized and nuanced forms of violence, but generally they're physical, sexual, psychological, and emotional abuse, financial and material abuse, abandonment, neglect, and serious loss of dignity and respect. In terms of the prevalence, I think the short answer is we're not sure. But according to the best evidence we have, it comes from a 2017 study of 52 countries, 52 studies in 28 countries. And the estimate is almost 16% of people aged 60 years of older and older were subject to some form of abuse. And we know with the COVID-19 pandemic, these rates were escalated. In Canada, our estimates are even less accurate because the best we have is based on a 2015 population-based estimate that says about 8.2% of Canadian older adults have experienced abuse in the past year. The highest is physical abuse, followed by emotional abuse and financial abuse, also sexual abuse and neglect. And we do know that older adults experience multiple forms of abuse, and they experience abuse over different times in their lifespan. So in terms of what the individual level risk factors are for abuse, when older adults have a disability or they're functionally dependent on caregivers, they're at greater risk. If they have poor physical or mental health, they're at greater risk. If they suffer from cognitive impairment or dementia, and if they have low income or socioeconomic status, that places them at greater risk. Next slide, please. We also know that there are some risk factors that occur on the perpetrator level, and those are people that perpetrate elder abuse. And in cases where there's a mental illness, where they have substance abuse, particularly with the opioid crisis, there's a much greater chance in elders receiving various forms of abuse at the hands of people in their lives that have substance misuse. We also know that if the abuser is also dependent on the older adult, either for emotional support, financial support, housing, or other forms of assistance, that places the older adult at greater risk. Next, please. But we know that elder abuse most often occurs within established relationships. So most common perpetrators are spouses or partners, and followed by adult children. And within those relationships, if there's previous family disharmony or conflict, they're at greater risk. Next, please. Unfortunately, those of you who provide service for older adults are quite aware that most cases of abuse go underreporting. And our most recent estimates suggest that 1/3 of cases of abuse against older adults is unreported to the authorities. So those missing pictures in this slide are the folks who, the pink squares are blank because we don't know those folks. They don't come to our attention, so we're not able to provide the kinds of services that we need. And then I'll turn it over to my colleague.
Hi, thanks, Christine. So a number of years ago, I think it was well before COVID, we began talking about this need to understand better about the prevalence of elder abuse. As Dr. Walsh has said, we are not exactly sure, and we began to think about this issue of disclosure and underreporting, and how might we better uncover who is experiencing abuse as an older adult. And so we use the word underreporting, and we're going to talk a little bit about what happened in the study. I would like to acknowledge Prairie Action Foundation because they were the funders of the study, and I think we were able to continue the study for about 5 years. There were many facets to it, and I feel that we worked hard and accomplished a lot. And one of the things we're going to show you later is a video that we produced that came out of the data of this study as well. There were a number of other people in the study, including Dr. Donna Goodrich, and I want to acknowledge all our student research assistants over time because they all played a part in the success of this study. So underreporting for sure is linked to how families, communities, and societies understand abuse of older adults. And we know that a deeply endemic ageism plays a part in how we think about aging, how we think about older adults, and how we think about abuse of older adults. So there are many reasons why older adults may or may not want to disclose or talk about what's happening. And I'll share a little bit from the literature, and then I'll share a little bit about the study that we conducted. I'll ask you to go to the next slide, please. So just by way of example, because there is a fair bit of really excellent literature out there, so just about abuse of older adults in general. One paper that I worked on with Dr. Brownrich and Dr. Ursel talked about the difficulty of just naming abuse. And another study by Dow talked about just the fear of negative consequences by the perpetrator or the abuser. So if I talk about this, maybe it's not the perpetrator's fault, maybe it's my fault, or there's a sense of shame or embarrassment about it. But there could be more systemic reasons as well, as Jackson and Hafemeister talk about in regards to not wanting law enforcement involved. Maybe people are quite aware of what's happening, but they don't want to call the police. And we know that there are other systemic failures as well, or maybe not failures, but gaps in the system. Service providers have told us that mandatory reporting doesn't necessarily ensure victim safety, and a study by DeLima and others also found that. And we also know that the funding for this kind of a resource comes and goes. It depends on funding in the system, funding in social services, which government is providing that funding and support. So service providers also say that there's just a lack of training and resources. So even if they are trained, they may not have the resources to do what they know very well would support an older adult. So there's some good literature out there on some of the factors that lead to underreporting. And I'll just ask for the next slide. So the specific focus on self-disclosure is what we were looking at. And so reporting abuse has to be key. If people don't find words for it or talk about it or find a way to share that with someone, it's hard to get appropriate services. And there's many reasons for that. So finding out more about the barriers and facilitators is part of what I'll talk about, as well as some recommendations at the end. So the next slide, please. So we did have three researchers. Dr. Walsh is situated in Alberta. I'm in Manitoba. Dr. Goodrich is in Saskatchewan. And so at first you'll see that the numbers that we recruited vary significantly between the provinces. And as we came to discuss this further, it was clear to us that Saskatchewan actually has the least provincial resources for aging centers, community work around abuse of older adults. And so there may be a suggestion that having less resources, oh, excuse me, that's modern technology. My phone is ringing, I'm sorry. So that one of the reasons we tried very hard to recruit from within Saskatchewan is that if you don't have community-based resources that are talking about it and focusing on it, you also will find older adults less likely to be aware and talk about it. Alberta has really strong resources and great networks. Manitoba is somewhere in between. I think we have some really good networks here, but we could certainly improve on those as well. So we had a mixed methods approach, which means we did some descriptive numeric analysis, but we also conducted interviews and focus groups in real time with real people. We were quite lucky that we were able to collect all our data all our in-person data before COVID began, so that we ended up doing a lot of other work during COVID. And we did have a community-based advisory committee that we went to on a regular basis that also included older adults and service providers. And I think that's really important when you're conducting this kind of research, is to make sure that you're hearing from folks who are part of your demographic. Next slide, please. So we'll talk now just about some selected findings or selected considerations that came up in our data collection. Next slide, please. So one of the things we found, and I think many of you will know this who are working in the area, and those of you who are in a situation where you're thinking about abuse in your family or something you're experiencing, we know that issues around naming abuse are really key. And we found that, and I conducted many of the interviews myself and have worked in this area for years, And I found that older adults don't always call it abuse. And so they might say, well, this, my nephew disrespected me, or there's some mistreatment, or I wasn't so happy the way they talked to me. So there's many nuanced ways of suggesting that something that someone else might call abuse, some older adults, whether it's cultural predisposition or again, as we talked earlier, self-blame or shame, there can be many reasons for this, but not calling it abuse means that it doesn't get called abuse. And so then how do you disclose that? So we heard that from quite a few people, and I'll read one quote here from a community social worker. Generally speaking, I don't like to use the word elder abuse, only because if somebody is experiencing it, to put a label on something that quickly, well, they often become much more defensive. So often we will talk about things that are hurting you, or things that make you feel uncomfortable, or have you had a situation where someone did something you didn't feel was quite right? So I think abuse is a word that's quite familiar to professionals, to researchers in the literature, but it may not be the most effective way to be working with folks in the community. So that was one of the factors. Next slide, please. So even if people understand it's abuse or they call it abuse, we saw in the data that this behavior was minimized or normalized in different ways. So older individuals who've experienced abuse may tend to minimize it or kind of normalize it. And they say others are far worse off than I, or others need the services more than I do, so I'm going to step aside. So an older adult shared how he reframed his abuse by calling it disrespect, but he did understand it was abuse. He didn't want to bring trouble into his family's life. So there might be a reframing of abuse in different ways, and that's one example. Next slide, please. Of course, we know typically with abuse across the lifespan, and this is no different for older adults, is the issue of social isolation. And so historically, the data shows that actually older men are more likely to be socially isolated than older women. But we do see that in the case of abuse and aging, social isolation tends to be a very strong factor. So social isolation may put people in a vulnerable position. They don't actually have anyone else to talk about. And nobody else is asking them, how are you doing? How do you feel? What's happening in your life? One urban dwelling older woman commented, I didn't realize at the time that everything was going on really, because he, the perpetrator, was keeping me away from people. I couldn't talk to anybody since he was always around. We've also discovered through other research in rural settings, I just wanted to finish up the other slide. We've also discovered in rural settings that social isolation may be just a secondary factor of geography and where you're living. So it's not just social isolation, but it's also kind of geographic isolation. And when you're aging and maybe you don't feel as comfortable driving on the country roads, that increases the social isolation that you're experiencing. Thank you very much. Next slide, please. So interestingly enough, and this is hard for people to understand who aren't familiar with the topic, but many people actually have a wish to protect their perpetrator. One of the older men that I talked to, and actually there's a similar quote on this slide, they don't want the person to have harsh consequences. It could be going to jail. It could be, less impactful consequences. But I know one older fellow I spoke with, he was living with his nephew, and he knew that his nephew had many troubles, was having a hard time seeking employment, wasn't able to pay for rent. And so the uncle was kind of taking his nephew under his wing and saying, you can stay here. But it turned out that the nephew began to have anger outbursts at the uncle. And the uncle really kind of felt very compassionate and understanding. And even when we were talking with him about the fact that this was abuse, he said, but I don't want my nephew to get into trouble. He's had a very hard life. So that could be one example, but there's many examples in which someone might protect the perpetrator. An older adult residing in a rural area shared that she did not want to report her older daughter, explaining that she has two daughters at home and I just couldn't see her being homeless and putting them into childcare. She's really good with her kids. It was just me that she was mean to. So we really can find many examples of older adults wanting to protect the perpetrator. If it is an adult child, I also found that they would say things like, this is the child I gave birth to. This is the child I've raised. How shameful is it now to say that this child is hurting me? I can't do it. So there's many ways in which that protection can happen. So the next slide, please. As I mentioned earlier, there are some systemic gaps and barriers as well. So there's the complexity of the reporting process, and there's a lack of appropriate services. And so even though we have fantastic people doing work in this area, there's many reasons why possibly people just aren't able to follow through with what they think would be the best option for an older adult. So there is a real complexity in the legal reporting process. Even if people say we won't call the police, this is going to be a different kind of process. We'll support you through it. There may not be the resources to really provide the kind of support that is needed. So service providers cited the need for older adults to make many phone calls to different agencies, fill out long, complicated forms. And we can keep in mind things like diminishing eyesight or English as a second language. So filling out long, complicated forms and engaging with the mainstream social service provision may not be everybody's first wish. There's also communicating with law enforcement. So some folks have had very negative experiences with law enforcement and they don't want to go through that. The court system and lawyers are the same. So there can be some fears in interacting with the system. And in this way, I have heard people say, well, I'd rather live with this situation at home than have to expose myself to what I'm also very scared of, which is all of these different parts of the system that may or may not support me. So one home care case, I'll go back to that quote there. Having been through trying to report an abuse case, I cannot imagine a senior going through that and knowing where to go next, what to do and who to talk to. The process would be very difficult for them. Thank you. Next slide. So there is a fear of a loss of relationships. So a fear of loss of meaningful and significant relationships, as I mentioned, if this is your only adult child or the only adult child who is providing some care for you, one urban social worker says, I think that at times that is probably one of the biggest barriers that we have to overcome. The individual is considering 30 to 50 years of the relationship. At the end of the day, they don't want that individual to be in trouble. So I'll just move on to the next slide. I think I have one or two left in this area. So fear of safety following disclosure. We know that abuse across the lifespan, this is not unique to older adults. People are somewhat quite rightfully afraid that if they report abuse, that their life is more at risk afterwards. So study respondents noted a hesitancy amongst older adults to report abuse because they have that fear, and sometimes quite rightly so, that the abuse will be potentially exacerbated or worsened. So an older adult shared she initially did not report because she did not want to worsen the harm. And so we do have a safe suite here in Manitoba, and people can choose to go to that safe suite for a designated period of time. But this also is a consideration where older adults say, well, then what? I'll be in the safe suite, and what will be the next solution? I'm on a fixed income, or I don't have other family here. And so there is that kind of a ripple effect of fears that escalate. So the quote here is, "You're scared to go anywhere." When I would first go down to the safe house, even when I was getting quite familiar with it, I was terrified to take that step out the door. After I got home, I was okay, but I was scared to talk to people. So it's that deep impact of abuse over time. And thank you for posting the safe suite. I see a lot of chat going on. I can't catch all of it, but I see Benedict has posted the safe suite. Thank you very much. So next slide, please. Trusting relationships. So we know that trusting relationships work very well when all other things are in place as well. So in one interview that I had, the person said that she began to talk to her hairdresser, that she had a long relationship with her hairdresser, and that was a person that she trusted. And she said, I just started sort of revealing things, and over time, I began to say more. So it doesn't have to be a trusted family member or neighbor. It could be someone else in a person's life that they see as supportive or non-judgmental. An older woman who fled violence emphasized the importance of having an empathic service provider. And so here I'll read this quote. The service provider has been the first person that has been more than understanding of where I'm coming from, of my condition and my views, and the first one that has actually been very understanding. So I certainly feel stronger in moving towards winding away or fixing the situation. So people cannot do this alone. They absolutely need a strong, trusting relationship. So I'll ask for the next slide, autonomous decision making. We can run the risk of being paternalizing, or there's different terms around ageism as well, where we're kind of trying to tell the older adult what to do or what's best for them. And I think it's very important that older adults know what's best for them, or at least they need to know what their options are. And so they need to have an understanding of what is my array of options, and then to be encouraged to think about what's best for them. And what's best for one older adult may not work for another one. And this is, again, where the trusting relationship is so important. Someone who can walk you through your options, who can discuss the pros and cons with you and say, if you go this way, these are some of the options. If you go this way, these are some of the consequences. So one rural seniors advocate mentioned trying to remain non-judgmental and keep reminding them that they have choices, that they have options. And when they're ready for that, there is support to help. And I think sometimes the hardest thing is to understand that some older adults will stay where they are, but they may change their mind in 6 months or a year later, that we don't have that control of providing them with options and then knowing they'll move out of an abusive or unhealthy relationship. So next slide, please. This is where I thought we might stop for the video. I'm aware of the time. So I'll just quickly check with Christine. What if we show the video now? Is that a good time? Okay, so we're going to just click the slides off for a minute, and then I believe either Rayanne or Benedictine is going to start the video for us. It's 3 minutes long, and this was created through our grant as well. And it is based on the data. And then we'll move back to Christine, and she'll wrap it up with some recommendations.
Sometimes we have trouble recognizing abuse, especially of older people in our lives. Of course, everyone has the right to be safe and free from abuse or neglect. As friends, family, neighbors, and community, we can help. We can encourage people to talk about elder abuse. And it starts with recognizing the signs. If you are an older adult experiencing abuse or neglect, or if you know an older adult experiencing abuse or neglect, talk to your neighbor, friend, spiritual advisor, family member, doctor, nurse, someone. Anyone you trust. Talking to someone is the most important step to getting help. Abuse is never right. Recognize the signs. People are here to help.
I think, have we done this slide? No. So one of the interesting things that we found is there's not always agreement between what older adults are telling us and what service providers are telling us. So service providers are saying that older adults have a lack of awareness of what elder abuse is and what resources are, but older adults say something different. They say they know what abuse is, but when they're thinking of reporting, they're met with unprofessionalism, and the services don't directly meet their specific needs. They have a lack of confidence in the services, so they're skeptical about the services, the effectiveness of them. They have a belief that service providers lack training and professional skills, and they're also concerned because many forms of abuse don't leave physical evidence. So they believe they may not be believed by service providers. Next slide, please. They're also concerned about privacy. So this was mentioned by many older adults, but service providers did not highlight that as a barrier. The other interesting thing was service providers highlighted the capacity as an issue for older adults as barriers to disclosing, but older adults in the study did not identify that. And it may be that, of course, the older adults in our study didn't have capacity barriers. So we came up with a few recommendations, and I appreciate the liveliness in the chat and the Q&A because you have lots of ideas. Our first recommendation is that although older adults in the study said they were aware of elder abuse and the supportive services, but their understanding of the various types of abuse was not as great as we think it could be. So we're suggesting that further public awareness campaigns should be directed at those aspects. Secondly, we're recommending that staff at agencies that provide services for older adults be trained, educated, and qualified so that they can understand what abuse is and that they can navigate through disclosures in sensitive, non-judgmental, trauma-informed, and culturally sensitive manners. So we're suggesting that the training needs to be ongoing and geared to ways that can help older adults make disclosures over time within that kind of a relationship. Next. So of course, increased funding for supports was identified by both respondents. Older adults and service providers suggested that there was a lack of emergency beds for older adults fleeing abuse, inadequate number of trained staff, and sometimes very long wait lists for services. And along with the training recommendation that was in the previous number 2 recommendation, that more training be provided to more general frontline staff. So folks in healthcare, social services, and legal practitioners. So not just people who are directly tasked with working with folks who may have experienced elder abuse, but folks who encounter older adults in their general practice. Next. The fourth recommendation has to do with the understanding the complexity of intrafamilial abuse. So as Kirsten mentioned, and I see there's lots of discussion about this in the chat, family relationships are sometimes very paramount to older adults, even if they're abused. So having supports for perpetrators of abuse is important. And I think sometimes it goes contrary to, we should be providing supports for victims, but victims of abuse often want to maintain those family relationships, and how to support those family relationships to be healthy and vibrant is one of the things that we should be doing. And older adults need support beyond just reporting. So they need help in rebuilding their lives, developing social networks and support systems, because as we noted, people that are in abusive situations are often socially isolated and have impoverished networks. So trying to enhance those is very important. Next. And I think this is a case study, so I'll read it, and then Kirsten will pose the question for you. So you can read it on the slide, or I'll read it for you. So Grace lives at home with her adult daughter, Annabelle, and her grandchild. She does not speak English, and while Annabelle's at work, she cares for William. She also cooks dinner every day and cleans the house as much as she was able, including doing the laundry. She has no other relatives or family in Canada. When Annabelle comes home, she's frequently tired, which leads to irritations and frustration. One day, she starts blaming Grace for not budgeting well enough to make ends meet while she brought groceries for dinner. After a while, this escalated to verbal anger and accusations that made Grace feel scared. Her daughter angrily even said, sometimes didn't Grace miss the old country and want to go back home? Or that she would need to move to a nursing home if she became sick. A few days later, calm would return and her daughter would apologize. Grace lives on eggshells, fearing that her daughter's temper, which would result in physical abuse. So I'll let Kirsten ask the question that you should consider.
Yeah, so the question here is whether this should be named abuse or whether it should be considered abuse. And so when we think about the cycle of abuse, it fits very nicely into how the cycle of abuse happens, where there's an escalation of issues, there's a flare-up. It doesn't have to be physical violence. In the case of older adults, especially, we see that the threat of physical violence or even psychological violence is very impactful. And then there is a sort of calming down period, a honeymoon period, and things will escalate again. And so in this way, I know we're going to save a little time for discussion. I just wanted to add that we would consider this abuse, but also both Christine and I, in different contexts, have done work around immigrant families and abuse with aging older women and aging immigrants. And so we can add that other piece of not being able to speak English around social isolation. When you look at some of the factors that we presented, many of them apply to this case study. And this was from one of our interviews, and it was depicted in the video as well. So I'm happy to come back to it in our discussion time.
Thank you so much. There was a lot to go through and a lot more questions to go through as well. So we're going to try to get this on the way. There's a lot of questions in general and quite a few questions about people who want to know. So there's a hospital discharge planner. There's a person who works in a not-for-profit home care and deals with frontline staff all the time. Two avenues of questions. Are there training availables, links that people should know about that they can share with their colleagues, and what are the paths to reporting for people who are especially in healthcare positions. So I just want to say, I don't want to take over the Q&A, but when it comes to the reporting piece, things are very different and laws are very different depending on where you are in the country. And it can get a little tricky. And there's one resource, if there's one resource that I would like everybody to kind of take home with them, it's the Canadian Centre for Elder Law created a practical guide to elder abuse and neglect law in Canada. It sounds like a mouthful, but they've made sure to write things as simply and as clearly as possible. And they break it down province by province, territory by territory, in terms of what are the laws and what are the obligations for people depending on what you do. So I'm putting this in the chat box right now. If you click on that ccelderlaw.ca link that I just put in, this will take you to the homepage of the practical guide, and you can then choose where you are and read the information. I think that is the most straightforward way for you to find information about what your obligations are based on where you are in the country. So that's question number one. When it comes to, are there any trainings out there that maybe you've encountered in your work, Kirsten and Christine? Is there anything that you would recommend as particular resources?
Yeah, I don't know of any specifically, and I don't know if you at your agency might have resources to recommend.
I believe Rayanne might have something to say about this as well. So Rayanne, if you can turn on your mic.
And
Let
I'll
me
just
know.
quickly interject while Rihanna is doing that. Our our different resources here come out of our community aging services. So it may be not going to law enforcement or calling the police, but looking at different community centers in your immediate environment and just calling them or talking to them. We also have an amazing Fort Garry Women's Resource Center that does work on aging. So it may not sound like they work for older adults, or it may not sound like they do work in abuse, but I would just trust a community agency in your neighborhood and just start there and really talk to anyone.
Yes, and I will add to this in terms of a national resource that has been tried and tested and applied across the country many times over. Neighbors, Friends, and Family for older adults is a wonderful resource to start learning about understanding how to approach a conversation about elder abuse or about mistreatment or disrespect. Obviously, part of the discussions about which language to use to not scare the person into silence, and how to be supportive of people who maybe disclose something to you. So I highly recommend that as well. Someone in the chat is saying they're working with older adults across Ontario. And they are a RISE advocate and they do restorative justice approach. So also an interesting thing. I think, Rayanne, they're interesting to know about elder abuse prevention networks in their area. And while we're on resources, I'm sorry, we're jumping around because the chat keeps updating and trying to keep track of things. We had someone inquiring about resources that are particularly geared towards Indigenous communities and older people. And I believe, Rayanne, you already responded in the chat, but just in case you missed it, I will link to that resource. Again, this is an awareness tool that was developed for Quebec First Nations elders, but you might still find some materials in there that are relevant or that can be adapted as you wish in your community. And I know Elder Abuse Prevention Ontario is currently working with Indigenous communities to develop more. So stay in touch with the APO. There will be more things coming down that way. There was a question for Christine and Kirsten that I thought was interesting that had to do with age, because when we're talking about older people, it is a rather wide swath of age cohorts. It can be, 60 and dynamic and socially connected, and it can be, 98, 100 even. Do you notice any differences in terms of what the person says are seniors versus junior seniors when it comes to either prevalence of abuse or even how they react or disclose?
I'm not sure about that, but I would say younger seniors have more opportunities for disclosure in terms of they're probably have more mobility and cognitive functioning, and more, perhaps even more economic resources, and aren't so socially isolated. So they have, I would say in general, more abilities to understand their situation and to do make the kinds of changes that they want in their situation, whereas increasingly older adults are more impacted by physical, cognitive disabilities. They are likely more dependent on caregivers, who's often the abusers, so more socially isolated. So they're certainly more at risk, and often don't come to attention of social service providers. They may only be seen by healthcare providers in the case where they have a related health care issue. So I think that they're certainly more vulnerable. I'm not exactly sure if that's answering your question.
I think it does. Kirsten, anything to add?
I think Christine said it really well. I would just add fixed income. That is going to look different for women over 80 than men over 60. So I think thinking about retirement funding and fixed income changes people's options as well.
Thank you. I know some people are leaving because we're just at the hour and we should be wrapping up. There's a couple of questions that kind of have to do with, if for those who can stay, I'll add this one more question that want to know about, why, I guess, that negotiating between the want to help, knowing that something is wrong, and what you were explaining, which is not wanting to paternalize and, have this compassionate ageism and kind of overriding maybe the wishes of the person who is experiencing abuse. Like somebody's asking, why can't I just call the police and make sure that they're safer? Can you kind of re-explain that a little bit more in detail?
I would just say that older adults, like all adults, get to make decisions about their lives. Some decisions we would agree with, and some decisions we would not. I think the role of a service provider is to stay connected, and to, or even a neighbor or a friend, is to stay connected and have that trusting relationship, where if the older adults decides to report over time, then you can facilitate that. I think it's a little bit different if older adults are incapacitated. Then I think your role is different because they can't make those autonomous decisions. I think so having those kinds of relationships, that you're supporting older adults to make the kinds of decisions they want. And in terms of reporting, a lot of older adults are really reluctant to report to formal authorities because they have been, in their own lives, they've been perhaps suspicious or had poor relationships, or they with those kinds of authorities like police. And they also don't want to get often their loved ones in those kinds of trouble. So I think it's following the wishes of the older adults and being there to support them.
Kirsten, any final words? I'm sorry we can't get to every question, but I think we could be here for another 2 hours if we did.
Yeah, I don't have final words, but just to add to Christine's comment, I think it is a very careful decision that someone can certainly make to call the police. We all have that option in life in all circumstances. So I just wanted to add that. Of course, that's an option, but I think it has to be really weighed out carefully whether that's something you want to do. It will change your relationship to the older adult, and it may not be what they want. So it is an option. I'm not sure it's the best one.
Thank you very much. Ryan, I know that there are a couple more resources you wanted to share. Do you want to take over?
Yes, thank you. Thanks for all the questions for everybody. They're really great. And as Benedict said, I'm just trying to go through and answer some of them or put some links into the training that we offer at Elder Abuse Prevention Ontario. And I know that, Kirsten and Christine were talking about other supports in your local area. I think that's so important. And Benedict mentioned the Elder Abuse Prevention Network. So we, as an we are provincial elder abuse networks, but we support over 40 local elder abuse networks. So they are sort of the eyes and ears in the communities as well, and do education and outreach and support as well. And I know in British Columbia, they have many networks. So if you go on the CNPA website, you'll find a listing of all the networks across Canada, and you can get connected that way. If you're looking for other services, because I know we have people from different jurisdictions, the Canadian network does have a listing, as you'll see, under each province of main phone numbers and organizations. So if you contact one of those organizations within your province or territory, they can then connect you more at a local level, or at least help you navigate that system. Because sometimes, as our speakers have identified, that navigation process can be can be very overwhelming for not only as providers, but for seniors themselves. So you will find information on the website and a lot of other excellent resources on CNPA's website. Also on Elder Abuse Prevention Ontario's website, we also have a search engine you can look for services. We also have 2 consultants that can help navigate cases for individuals. Organizations can contact us, as well as seniors or family members. And we also help navigate through that system. And we have partnered with the RISE program, which I believe someone has just mentioned in the chat box. And helping navigate the system, because it is not clear cut within Ontario anyway. I know each province and territory is different, which makes it more complicated for that reporting process. So if you call our main number, and someone will call you back and follow up on your situation and further help you navigate to answer questions, I think, that are put in some of the questions here in the question box about reporting. If you're in a hospital, they can help you answer some of those questions about where you disclose and who you go to. So just briefly, for reporting purposes, not to get deep into it because we don't have time, but the only place that it's mandatory within Ontario to report is in long-term care and retirement homes. Everybody has the responsibility to report to either the long-term care family support and action line or the retirement home regulatory authority. That's mandated. Anybody has to report, including staff. The only people that are not responsible are the residents themselves. That's not to say they don't have to, or they can't. It's that there's not mandated by law that they have to. The other place to report if people are not happy about services or they're not getting answers is the patient ombudsman. You can also go there to ask them for support, saying you didn't get what your complaint wasn't resolved, and they can help walk you through that process as well. And also, dementia was brought up quite a few times today in our discussion. If you know someone who's at risk and is not capable of understanding, appreciating, the Office of the Public Guardian and Trustee can sometimes, or their job is to intervene in terms of situations such as that, and they will try to help navigate through that process to help ensure the safety for that individual as well. And I'm just going to ask Benedict to follow up on reporting for her organization we've talked about, but just to have the last words around that, or we've kind of sort of talked about it.
Sure. Well, at the request of everyone in the chat box, I have reposted the link to cnpea.ca. If you go to our website, top right of the page, there's a big button that's called Find Help. It will take you to a page that breaks down information by province and territory with a list of support services that can be of help to you in various situations. As you can see on this slide, we've also even added a bit of information about reporting for another kind of scenario when we're talking about frauds and scams, which are also quite prevalent and targeting older people particularly. If you have been a victim of fraud and scam, it can be also very isolating and you can feel very ashamed. There is nothing to be ashamed of, and you should absolutely report it, not only for your own sake, but also to hopefully help other people avoid the same situation. So we recommend that the Canadian Anti-Fraud Centre be your first resource. Thank you, Ryan, for going back. Elder Abuse Prevention Ontario, which is represented by Rayanne today, has a lot of information as well about all things elder abuse prevention and response in Ontario. You can see the link on the screen. And again, I cannot recommend it enough. The Practical Guide to Elder Abuse and Neglect Law in Canada will help you figure out what your obligations and duties are, depending on your profession and your province or territory, when it comes to reporting abuse. So I'm putting that link back in the chat box because it is quite worth it. And then for those of you who have the time and patience to be with us for 2 more minutes, our next webinar is going to be coming up very soon, October 3rd. We will be doing an event about advancing the human rights of older people and kind of looking at where we're at with the work on pushing forward for a UN convention on the rights of older people. A lot of work has been going into this over many years, but this year particularly were many developments. So we'll be doing this with a bunch of great partners like the ILC Canada, Canadian Coalition Against Ageism, Global Alliance for the Rights of Older People. This is happening October 3rd. We kind of picked a date that is a little bit halfway between October 1st, which is National Day of Older People, and October 8th, which is Ageism Awareness Day. So it sort of covers both topics. So we hope to see you there. And after that, I believe there's one more, Rayanne. Yes, October 9th, Signal for Help Responders, supporting someone who is experiencing abuse. So I think it directly flows from today's presentation. So if you were interested in today's conversation, I think this one will also be of interest to you. I see someone is asking about the EAPO phone number in the chat box. So very quickly, I'm going to type this in, where this is a number you can call to be connected to someone to receive some resources, advice, system navigation. And here it is. Rayanne, if you have anything else to say about this line, I know you get a lot of calls, and so people might not be able to reach somebody right away, but you will get a call back.
That's right.
And as I mentioned, Ageism Awareness Day coming up October 9th. There's a campaign that's going to be running from October 1st to 11th. So you can find more on the website of the CCAA. And we invite you to support it in any way you can. And then finally, evaluation. If you stay on the Zoom window once you're about to close. Oh, you just triggered a poll. Okay, go for it. Explain it, Ryan.
Sorry, just before, I know people are popping off. So we're just doing a quick survey. There's just 3 questions, just to have people ask about just satisfaction, if they've learned anything, and if that's going to inform or change their the delivery of their programs. So we won't share all the results because it just takes time, but we do appreciate everyone engaging in that in the conversation or just giving your feedback. We'll also send a link also because there's other questions that we do ask. We'll send the survey actually we'll get a pop-up after this webinar, and then also in a couple days with the link to the recording of the presentation. I know that was asked. You will get I'm just going to stop that now and then ask another one. You will also get the copy of the PowerPoint presentation, the recording, and any of the links that Benedict's been sharing. So we thank you for that, because there was lots of chat box. We encouraged, it was just amazing, all the discussion. And I think there's appetite for maybe another follow-up session on this topic. So we do appreciate everyone's feedback. And thank you to Christine and Kirsten for the time that you spent preparing the presentation and our time here today. We do appreciate you sharing your knowledge and your research, and we look forward to any other papers or discussions that come out as a result of your continued work in this area. And lastly, to our ASL interpreters, we always appreciate their support in our webinars, and we always include ASL in those in our presentations that we do. And then this is just the last question. I think I can advance the slides. So our contact information for both Benedict for the CNPA and EAPO, if you have any further questions or follow up from the presentation today, you could reach out to us by email. As Benedict said, if you call our head office, somebody will call you back. Again, you can go on our website and find all the contact information and resources there as well. So thank you very much. Fall is upon us and the leaves are falling. We appreciate everyone coming today. Benedict, do you have any last comments?
That is all. Thank you all for being so engaged today. It was really a pleasure, and we'll see you on October 3rd.
Thank you.